So Martin, you've been a UKCP psychotherapist for a while. Tell us a little bit about what you do and the people that you work with.
Well, one of the things I work with particularly is to do and help people with trauma. People who've been through an event which is totally out of their understanding, totally out of their expectations, unimagined and unimaginable, and help them try to make sense of it together with themselves and also with their colleagues at work or their family and friends and their relationships.
So this would be something like a sort of a bombing or a dramatic event that they've...
Not necessarily. The National Institute for Clinical Excellence only defined PTSD in 2005.
That's post-traumatic stress disorder.
That's correct. Post-traumatic stress disorder, and they describe it generally along the terms of a catastrophic event that causes pervasive distress, and that is catastrophic or threatening.
Mm.
So it isn't a sharp jump. It isn't something that comes and goes quickly. It's something that changes people's perception of themselves and their world for a long period of time. Now that sounds dramatic, and as you say, a bombing or a natural disaster, an earthquake, tsunami. But actually, we all have our own traumas, whether it be going into hospital, whether it be a diagnosis of cancer, the death of a loved one. Trauma is subjective and needs to be defined, in my instance, by the client. And very often when I suggest to them that they've had a trauma, some people are very surprised, and yet they exhibit a lot of the symptoms, a lot of the behaviours that I would expect to see and do see from someone who has been in a terrorist activity or in a natural disaster.
And trauma can have quite a big impact on relationships.
Oh, a huge impact. If we take the person who goes through trauma first, very often what happens is their whole view of their world changes. We all carry with us an understanding of the world. We expect trains to arrive, we expect people to do various things. And suddenly the ground shakes beneath us or a bomb goes off. Somebody close to us dies. And then we begin to question everything. Our own understanding of where we are and what's going to happen. Our trust in the world can be damaged. Our trust in ourselves can be damaged. And one way to respond to that is to withdraw. And also, if we've been involved in a particular public event, is to gravitate towards people who've been through the same thing as well, because they have a shared experience and there can be some understanding of that. So for the partner of somebody who's been through a traumatic incident, they could see their partner, whether it be their husband, wife, girlfriend, child, colleague at work, suddenly go through what they might categorise as a personality change. They withdraw, they're fearful all the time. They change their patterns of behaviour. They don't go to certain places. They don't travel by certain modes of transport. And if either partner is not aware of what's happening, then they can find other excuses. Oh, you don't love me anymore. You've always behaved like this. You don't respect me. You don't understand what's happening. That sets off the insecurity for both partners. And that then can spiral to a kind of a new map of the world that says either I can't trust anyone, so I'm not going to trust anyone. And that includes the person I've loved for X months or years. Or the partner can say, well, this is unfair. Why are you treating me like this? Why are you so distant? And therefore blame comes in.
So if you have somebody in your life who's been through a trauma, how can you support them, or how can you look after yourself, perhaps?
Well, if we talk about looking after other people to start with, there is a model called the PIES model, which was developed in combat stress and has 4 elements to it. And what they say is, if you want to help someone, then do it close to where the event happened. So, for instance, someone's been July the 7th on a train. Well, it could be a train accident, not necessarily a terrorist accident. Help them get back on the train again. Help them go back to the place where the event occurred. Because people do start changing their understandings and the fears can develop very, very quickly. So it's about, rather than taking them away from the place, it's gently leading them back to the place itself. And then there's doing it very quickly. Waiting doesn't really help. It's about helping the person to talk about what's actually happened to them, making sure that the space is provided. Then it's about hope. Most people actually respond. most people are quite resilient. They return to their normal functioning after a period of time. And keep it simple. How we can help other people is a process called diffusing, which actually is talking to people, again, very quickly after the event. Hopefully, if it's a workplace event, rather than sending them home, getting them in the office to do a simple job, keeping them connected to their communities, and giving them the space to talk about what happened in whatever way suits them. Simple questions, frequently asked, in a way that's hopeful, reminding them, people get over this. It just takes time, and it'll take them as long as it takes them. So providing that support, in a sense, I know love is an overused word, but actually that unconditional acceptance that says you've been through something dramatic, something out of the ordinary, you will get better from it, and will just take a bit of time from it. There are a group of people who go through a traumatic event as defined by themselves, hospital, someone dying, or defined by other people, a natural disaster or a terrorist event, and they come out of it and they say, right, no more rubbish. I've been through this, I'm going to do what I want to do. And very often they will leave their jobs. Sometimes they'll leave their partners, though not always. They'll certainly want to do life differently. Their life will have been restructured. Different things will then become important to them. And they'll take the experience of having come through the event and build upon that. And we call that post-traumatic growth. I know what I can do. I know what I can survive. Actually, I'm going to make this relationship work better and differently. And of course, the other partner can be a bit left behind initially. So my work sometimes has been about helping the partner not involved in the trauma, growing themselves and understanding that they can trust the changes in their partner.
Do people ever fully recover from a trauma?
Oh yeah, absolutely. And it's sometimes people might over-recover into that post-traumatic growth group where people actually I'm going to do a lot better. I'm going to look after myself more. Most people come back over a period, and it depends on the period, to a normal functioning. You drive your car, and if you've been in a car accident, even a small bump, if there is such a thing as a small bump, that's shock. As our world then rebalances. And then you move on. People have been in great traumas, and over time, they recover. If you're asking, are we the same? Then no. I think
it does change you.
It does change it. I think there was a philosopher in America called Oliver Wendell Holmes who said that a mind once stretched never returns to its original shape. And it's true, the world is never the same again. However, it needn't be negative, it needn't be fearful. You needn't be hyper-vigilant all the time. Not every train is going to crash, not every car is going to smash into you. Not every person you love around you is going to die tomorrow. And it's about regaining that trust, rebuilding the map, so that you have confidence in yourself, confidence in your partner that although the relationship will change, because the events have changed and the learning has changed, the relationship actually can get far stronger.
Martin, thank you very much.
My pleasure.